Joining me from the Brockville General Hospital, we are talking with the manager of mental health programs, Jessica Matysiewicz, as well as nurse practitioner, Melinda Billett. So, ladies, welcome to the program. Thank you for Zooming with us today. We really do appreciate it. Would one of you please tell us what is the Concurrent Disorders Stabilization Unit?
So the Concurrent Disorders Stabilization Unit is a program within the Inpatient Mental Health and Addictions Unit at Brockville General Hospital. And our unit or program is to support individuals who have concurrent disorders, which means they have a mental health concern and a substance use concern. And so the program is a stabilization program, meaning it's a short stay in hospital. So individuals come and stay with us in the hospital. And the program provides medical management of withdrawal. So for substances that they're using, alcohol, opioids, cannabis, stimulants, including crystal meth and cocaine, we will support them with our medical team, myself and a group of physicians, and work through helping them safely discontinue using those while they're in hospital. So we use medications and other treatments to help manage that. The program also involves psychiatric consultation, which means that a psychiatrist sees the patient and tries to help look at where they're at with their mental health concerns and what treatments would be helpful for them. And then we have a short therapy part of our program. And what that means is we have groups and individual programming that helps individuals reflect on their journey with mental health and substance use, set some goals around where they want to go in this journey, and then make some plans, safety plans around future substance use, how to help them safely navigate sort of their path forward. We also look at coping strategies. We have support from our dietitian and other resources just to do this kind of wraparound care of the individual. Our program also allows us to look at any medical concerns that the individual has. So identifying any other health concerns and treating those while they're in hospital. And then the last part is connecting them with resources in the community, whether that's with our local addictions and mental health agency in the community, other programs, as well as our own outpatient mental health program, Brockville General, to provide support after they leave the hospital.
That's nice to hear that they do have support once they have left the program. So the program is the 4 weeks, correct? So when the referrals, are patients referred to you, or how do you have people that are in your program?
So it's a self-referral process. So you do not need a doctor, or you don't need a nurse practitioner or anyone to refer you. You can actually refer yourself. And the reason our program is set like that is to allow easy access to the program, because not everyone has a healthcare provider who can help them do the referral. The individual does need to be 18 years of age or older, because our hospital provides adult mental health programming.
Yes, whereas for children, so they go to a children's hospital, correct? Okay, yeah. Sorry. Okay. Mm-hmm.
And the individual needs to be able to participate in some of the group programming. And so an individual who has a severe intellectual concern might not be able to come to programming. And the only other time is that the individual needs to come voluntarily. So the program is a voluntary program. And so individuals who are required to come by a court system or other reasons would not qualify for the program.
Okay.
It needs to be voluntary by choice. Mm-hmm. And the individual is able to leave the program at any time because it's voluntary.
So, Jessica, it's all confidential, correct?
Correct. Yeah.
So, do you? If I understood you right, Melinda, you have the intake. You already have a list of individuals for the next 4 weeks, whenever that will start. Okay. Do those individuals that are signed up for the 4 weeks, do they come in all at once, or do they come in rotating? Or is it all at once?
No, it's a staggered start. So we typically admit people on Tuesdays, Wednesdays, or Thursdays.
Okay.
Depending on their concern and what we anticipate the medical management to look like.
All right, now I get it. Okay, I wasn't sure about that, and I thought, well, how do they do this? Is it something like classes out of school whereby you got X number of people and you start off with it? So okay, I got you now. Melinda, you said something about goals. What kind of goals are we talking here?
So individuals come to our program with many different goals related to their substance use or their mental health concern. So they might have a goal that they don't want to use alcohol, for instance, any longer. That might be their goal. And so we work with them and talk about strategies to help with that. Their goal could be that they want to use less drugs or substances and or use in a safer way. So we look at substance use from a harm reduction process, which is a continuum. And so some individuals don't use any, which is traditionally called abstinence. And other individuals, we want to support them to use in a way that's safer for themselves and keeps them safer. So we do lots of teaching and coaching around those things. And then other goals are things like sorting out their mental health concerns. So for many individuals who use substances, they know that something else is going on, but they don't know what it is, and they haven't found an optimal treatment for it. So the goals may be around that, maybe around connection to community support, so a counselor, maybe around stability for themselves and their family. So we get a lot of different goals around that, and we try to meet with each individual and work with them individually and then in our groups towards meeting that goal and working towards that long term.
Wow, that's awesome. So Jessica, when did this program actually start?
Yep, so we opened our doors in April 2022. And so we just celebrated our first birthday this spring.
Whoa. So it was a program that was needed then.
Yes, especially in Brockville community. We have a big, there's a lot of substance use, a lot of concerns. So we wanted to do something to help out our community in particular.
Yes.
People that live here. So.
Okay. So the intake is at any point in time. So how many people would be on your waiting list right now? How far out do you have people coming in? Are we looking at October? You have a list of individuals that will be coming in October?
So we run a wait time anywhere of 3 to 5 months. So we could potentially have up to 5 months.
Okay.
However, that is if 100% of people on our list are to come.
Yes.
So based on my experience in the program for the last year and a half working with our intake team, I would say that people are coming to the program within about 3 months, although it might be a little bit longer. Sometimes it takes us longer to connect with individuals. Some individuals have limited access to phone, internet. So we connect with them through our peer support worker. And so some people it's longer than that time and some people it's shorter. It definitely varies. But we sort of sit somewhere in the 3 to 5 months if every single person on the list was to come.
Okay, because each person is unique. What will work for one person won't necessarily work for another person, correct?
Mm-hmm.
All righty.
Absolutely.
Okay, so ladies, is there anything else that you would like to add and tell our viewers relative to this particular program? Like it's obviously, it is a success, correct? From your eyes, from your standpoint, it's a success. There have been people that have been using the strategies that you have put in place and helped them with, right?
Absolutely.
Yeah.
So is there a possibility of this expanding instead of, what is it? Is it 5 people that you have for an intake? 5 to 6 people?
Yeah, so we started off as a 5-bed program. So
yes.
We had 5 spaces available at any one time. We've gone up to 7 dedicated beds.
Oh, you're up to 7
already
now.
And the goal is to reach 10 dedicated beds.
So you're going to be reaching 10. Oh my heavens. So that will mean that the people that are on your waiting list or that you have scheduled will be coming in a little bit sooner than thought. Yes? Awesome.
As we have more availability, and we are flexible in how long people stay. So some people might stay, for them may only stay a few days, might stay a few weeks. Other people will stay 4 weeks. Other people actually need a bit more time. It takes longer for them to stabilize. So they may stay a few more weeks, even up to 6 weeks. And the benefit of our program is we have that flexibility. so that we can do that for each individual. And that allows us to sort of have people coming regularly, but also means we may have a bed that's empty earlier than we anticipated, so someone can come early.
Well, ladies, thank you ever so much for talking with me today. You've really opened my eyes up as to what is happening for this particular program. And as you had mentioned, Melinda, there's other programs too, depending on where you fit in.
Thank you.
So thank you ever so much. Anything else that you want to say before we let you go? Jessica?
I don't know. I mean, I would love to celebrate the robustness of our program. We have so many different professions that are involved, although it's only 5, 7 people at a time in the program. We have a team of our nurse practitioner. We have a medical lead, Dr. Andrew Everett. There's a team of physicians who support the program on a weekly basis. We have occupational therapy and peer support, a concurrent disorders specialist, dietitian, pharmacy, psychiatry, and then our whole team of nurses. So I think although it's a relatively small program, we have a huge complement of wonderful professionals who help and support these individuals. So it's really a wonderful thing that we have to offer here.
It sounds like you're covering every base. I mean, when it comes to wellness, it sounds like, wow, what an awesome program. Good luck to you. Thank you ever so much, ladies. Bye-bye.
Thank you.